So,
if
and
you
then
look
just,
at it,
just let me,
it's
yeah.
coming. But like it, so see, can you see it? Like look at the arm difference.
Yeah, I can see the shoulder difference,
Look
the
at-
arm difference.
See how this is? It's not allowing the bicep and the shoulder to hang. See how
Yeah.
this is like natural? This side is like.
And this side is raised like that much more.
So even if I come up and hit like this,
Mm-hmm.
it hurts all here, all down to here, and it starts here. So I don't know if that's the shoulder
do
or
a
the
lat-
lat.
Oh, it's a little bit of everything. Everything's kind of been in there.
It is.
Take
I can feel
take
it,
the
bro.
shirt off. Let's
Yeah.
see what you look like.
I'm not content shoot, but
It's okay. Neither am I.
but like look, see it.
But if you see it,
I don't
yeah,
know if you can see it.
yeah.
I don't know. Somebody's like, bro, I think it's arthritis stuck in there. I'm like, I don't fucking know.
That I wouldn't be able to tell. Does it click or anything?
I mean,
No.
not bad. Like
Nothing more than usual.
nothing like you would hear like if you're.
Just stand straight, looking straight at me, and I can tell that this side just stayed naturally. This side's higher than this
Way
side.
higher.
This side doesn't move at all. Pliability in there. It's limiting. See how this muscle is starting to feel just a little flaccid.
Yeah.
It's not firing
Nothing.
the way it should.
Mhm.
Where this muscle has
Yeah.
density.
See if you look at this bicep, feel that? And then
Density.
I can't even squeeze it because it tenses up here and it goes down to the bicep.
Everything from here, like put the arm down, everything is pulling upward.
Yeah.
And it's even affecting the lat.
The lat,
Dude,
yeah,
I can
yeah.
just tell by looking at the lat,
lat.
feeling it.
Yeah.
So,
I don't know. I mean, this has been an ongoing issue for 18 months.
18
Plus.
months?
Plus.
oh wow. And
And I
you're
did-
still training and you're still doing everything.
I'm still doing everything heavy, fucking
Yeah.
sleeping on it wrong, like sleeping like this every night,
Yeah.
waking up and my hands numb, just fucking the whole nine
All
yards.
right.
But like this is, I can't, even if I compete or not, I want this fixed.
Yeah.
Like I want to compete, but
Mhm.
this needs to get fixed, bro.
Yeah.
You know?
I think we can show you some
Something
good
in there.
improvement in there.
Yeah.
Dude, that's rock solid. The fact that this is solid, this is overactive, and this isn't firing.
Nothing.
That is just a combination
Yeah.
that's no good.
And I
So-
think what happened too is it messed up the blood flow to the tricep.
exactly.
Like, cause there's tricep blood there, but like here it is, but there's missing some blood flow.
yeah.
So
you
even though-
understand blood flow in the pump, and
Yeah.
you know it's missing it.
Of course. I
Okay.
can feel it, bro. Like when I'm training, there's nothing there.
All right.
Like
yeah.
before when this happened, I was so fucking like everything would fire.
Yeah.
Now it's not. It's just like I have to like really engage it, like unilateral.
Okay.
So
Sounds good.
Yeah.
No, I think we can help you out, bro.
okay,
You ready?
yeah, I'm ready, bro.
Oh man.
Don't kill me.
All right, everybody, you heard the introduction there. You saw the consultation, the way this gentleman walks in. He's an active bodybuilder. Issues going on down the arm, the forearm, the shoulder, the neck, the pecs. He thinks it's pulling on the lats. It's like, how do we approach this? Like, we have to look past the technique. Let's look past the technique and only look at alleviating the stress level or the tone of frequency inside the muscle tissue. Bodybuilders are very, very unique athletes because they can understand their body and the muscle tension and stress and when things aren't properly firing. So they're very unique athletes. So he had a lot of stuff to tell me. And after assessing the situation, where we're going to start at is the upper fibers of the pec. And we're just doing some cross fiber friction in here. What I want to do, since this muscle is overactive and pulling upward, I just want to relax this tissue very, very well for as much as I can. And I really did dedicate a lot of time to the upper fibers of the pec. It wasn't just 2-3 minutes. I probably dedicated 10 to 12 minutes. That's how much tension the upper fibers of the pec were holding on to. So why did I spend so much time on this? Like, why did I decide 10 to 12 minutes? I kept reassessing the situation of those muscle fibers and moving that arm. I eventually had to move into some muscle scraping just to get into a little bit deeper fibers of that because it was starting to show, expose mostly, I should say, scar tissue. And we want to get that blood flow to just really start moving really good. And where I'm scraping right now, that is the attachment point to the pec major. And I'm scraping upward towards that anterior delt. So what I'm looking is trying to get movement in there, and then adding a little bit of manual therapy. So it's very methodical when you go into this, because the way he explained everything, it's not just a muscle issue, it's also a neurological issue. So it's more than just, oh, the muscle's tight or the muscle's knotted. We have to look at neuromuscular firing. How come it doesn't fire? How come certain muscles are flaccid? Some are overactive, some are very tight. The worst thing about this is that it's all leading to the joint of the shoulder, not just the glenohumeral joint, but the AC joint. And that's what's causing the lift, which is bringing an imbalance structurally to the muscle group. So we have to use a variation of modalities and techniques to just really get the muscle to fire differently. I always like to start off with assessing the muscle tissue, doing cross fiber friction. I believe it allows me to read the muscle tissue a whole lot better, and then neuromuscular therapy and trigger point. But everything we're doing on this gentleman is we're working in the direction of the shoulder joint, starting with that pec, then the attachment to that pec major, bringing some blood flow into that anterior delt. That's just a calf muscle, so we just want to bring blood flow in there. And now we're moving into the forearm, and this is a very unique spot. We're not looking to just really relax the muscles on the forearm, but really just open up the pocket where where both bicep heads attach to. We're just opening up that pocket where, as we open that up, then I can really work on the attachment point of the bicep. And if you notice, he's talking to me. He's not screaming in agony. So again, I'm trying to find out what the tone is of the stress level. Then we are manipulating it, and that's part of the torture room theory. How can you manipulate stress levels? So I have understood that if we can manipulate the attachment point, the tendon to the muscle belly, then the muscle belly can be worked on a whole lot easier, less tension on the client, and we can actually manipulate the muscle tissue to actually operate the way we need it to, or guide it to where it feels normal when the person is active in whatever they do. So that's what I was trying to do on the forearm, is just open up that pocket to the attachment point, manipulate the stress level on the bicep attachment point, the tendon, and then we're doing some trigger point work here right on the bicep. And I'm really trying to split those bicep heads open to just bring in more and more blood flow in there. So, and right here, we're getting on that coracoid brachialis. Now, some people kind of fight me on this one, but how that coracoid brachialis works is with the rotation of the wrist. That's when it starts to operate. So knowing when you lift anything, any active range of motion that you do, you're always rotating that wrist in some fashion. And that's a stabilizer muscle right there. So we really wanted to open that up so we could get into that pec minor. So the pec minor is playing a vital role. And a lot of people always ask me this, like, what's wrong? What's the problem? Is it fixable? Like, which muscle is it? It's never just one. It's always a combination of a lot of them. Again, we are looking at active muscle groups, assisted muscle groups, and synergistic muscle groups. So that's why your technique has to be able to vary at the drop of a hat, depending on how the muscle is going to respond to your touch. Moving from that pec minor into that anterior serratus, which assists the shoulder blade in movement, something we call scapular delivery, so it moves and glides in its proper range. Here we're doing some gua sha just to break up, and this is superficial right here, just to break up any fibrotic tissue, any tension that's adhering on that fascia, and that's going to allow that lat to just open up. And then we're moving into the pronator teres. So actually, no, this is just the pronator. So in the forearm, this helps relaxing this forearm, the pronator in the forearm actually helps with depression of the shoulder blade. So that external rotation will allow that shoulder blade to actually move downward just a little more. So it's not raised up so high. It all depends on how it's holding onto the joint. So if we can get that arm to just externally rotate, it will allow that shoulder blade to depress just a little bit more. And then we're going to get into that subscap with some active range of motion. So there's some active release right here. And, I'm on the superficial fibers here. Nothing is really too crazy. If you can tell, he's even talking to me while we're doing this. And now we're getting into the teres muscle, rotator cuff. So, and this is some more active release treatment. Again, this gentleman is an active bodybuilder, so he's been training even though he's completely off balance. So I want to get a little bit of movement in there and, activate the muscle tissue, because he's going to go right back into the gym. He's not going to change his weekly activity. He wants to go right back to the gym, if not today, tomorrow. So that's why we're doing some active release treatment on that teres muscle. And knowing that there are some neurological issues going on with that shoulder, blood flow, numbness in the arm. Obviously, we're going to get into the neck. Here, we're doing some active release on the scalene muscles. Now, we all know the scalenes, anterior, medial, and posterior scalene, attached to ribs 1 and 2. So it helps with that contralateral flexion, and it helps with abduction of the arm. Anytime he lifts that arm up, those muscles are going to be highly active. And if they're already stressed out, they're choking off that brachial plexus nervous system there. So we want to open that gap up and bring a lot of blood flow and let those muscles fire just a little bit more. Now getting him turned over here, we're going to start right on the lat. This guy's a really thick dude. So as soon as I assess that lat, it is tough. It was tight. This guy has quite a bit of muscle, so we had to use a little bit of deep tissue on him, and using that elbow allowed me to soften up that lat just a little bit more, so those muscle fibers can open up, bring some blood flow. And now I'm doing some trigger point work right on the posterior serratus. This is going to allow that shoulder blade to drop even more, and we can start moving it outward and getting into that teres major. And that's a stabilizer muscle anytime he does that external rotation or lateral flexion. So it's going to stabilize that shoulder joint. So we want to get in on that, and also getting that tricep. So the tricep and the teres, they cross paths as they get around the shoulder. So when one is affected, you have to, or I would say at least it would be a good idea to work on the sister muscle there. It's the tricep, and guess what? They work together under tension when there's activity. So we go back and forth on this one. Now, I'm a big fan of working on assisted muscle groups, just because if an active main muscle that brings the activity is too tight, too knotted, and the person is too dense, you can't outwork that muscle. You're gonna burn out. But if you can relax assisted muscle groups or manipulate that tone and tension of frequency of stress on the active muscle group or the tendon to the active muscle, your work is going to be a whole lot easier. The muscle's going to actually respond a whole lot better to what you want it to do and how you want it to start laying structurally on the body. And once we ended up finishing up with the teres and that tricep, we're going to get into the meaty portion of the traps. Now, this guy has a lot of traps, a lot of muscle. Luckily, I have strong hands, so this is actually quite easy for me. I do this all the time, and I like to work all 3 heads of the trap individually and then working right along the spine. A lot of people always ask me if my hands hurt at the end of the day. Sometimes yes, but often not really. I can handle it. And just because this guy is kind of beefy, guess what? We had to eventually move to the elbows, and all we did, this is very, very slow movement. We just worked right around that shoulder blade, right around that scapula. So this was a very slow movement. I wanted to get good muscle response from all the tissue in between the shoulder blades, just to alleviate everything and get him to move properly. So going from top to bottom, then bottom to top. And I think we were able to help this guy out and really show him how manipulating stress, how bringing a different vibrational frequency into the muscle tissue can really help him out. We need to get that muscle to move and respond the way it should.
Look how it's opening up. Look.
See, you weren't able to rotate that arm at all.
No.
And now we got it pretty even. So
Let's see here. Yeah, I can even get into that.
yeah, and get that elbow to pull back a little bit more.
I couldn't even get that range,
And this is just the beginning of what can be done,
bro.
and just keep improving from here.
This is gonna. You're my guy. Serious. That was, dude.
You guys heard it, people. You guys heard it.
I don't even have any. Look at this. Like I couldn't do this. I couldn't even do this. I was like this.
Yeah.
Now it's about even, and that's one session. So, we're gonna get our time in here.
Oh man,
It's
just
gonna set it off,
stay right there.
and then also, yeah,